And I guess we're going to start. So, hello, everybody, and good evening. It is my great pleasure to welcome you all to our first virtual Pakistan International Neurosciences Society annual meeting 2021. For those who are new to our conference, we are pleased to meet you. And for those who are returning, great to have you back again. Before I introduce our eminent speaker, I would like to take a moment and talk about the history of Pakistan International Neuroscience Society. The PIN's inauguration meeting took place in 1988 in conjunction with Pakistan Academy of Neurological Sciences. The key leaders who participated in the meeting includes Professor Akhtar Ahmed, Professor Ashfaq Shoaib, Professor Tipu Siddiq, Professor Hassan Aziz, Professor I.H. Bhatti, and Dr. Ahmed Asif. The following PINS and Pakistan Academy of Neurological Sciences meeting was held at Aga Khan University Hospital in 1996. The most recent PIN's annual meeting were held in conjunction with American Academy of Neurology at Boston in 2017, at Los Angeles in 2018, and in Philadelphia in 2019. Next, I would like to thank you, the PIN's election committee, on conducting a transparent election and assistance in constituting new executive members. We would like to congratulate Dr. Danish Bhatti on becoming the first elected president of PINS. I'm very confident that the new team will take PINS at the next level. Currently, I'm very excited to announce that the newly elected leadership is working on numerous projects, which includes PINS official registration, website development, establishing a social media presence, and various educational projects, including monthly grand rounds and membership drive, and many more. The executive member will be providing an update regarding each project today from 8 p.m. to 9 during the business meeting. Moving on today, we are pleased to welcome Dr. Richard Benson, a very special guest from the NIH. Dr. Richard Benson is currently Director of Office of Global Health and Health Disparity at NIH. Prior to this, he was Associate Medical Director of the NIH Stroke Program at MedStar Washington Hospital Center and a Senior Faculty Member of the Vascular Neurology Fellowship Program at NIH. He's also a past president of a Greater Washington Region American Heart Association Board of Directors and current board members. In the past, he chaired the mission committee for the Greater Washington Region and was responsible for enrolling over 1,000 community members in the AHS-sponsored Heart 360, Check It, Change It, Blood Pressure Self-Management Program. Dr. Benson attended Fisk University in Nashville, Tennessee, and received a Bachelor of Science degree in chemistry. After working for 1 year as a biochemist at Case Western Medical School, he attended Meharry Medical College and received an MD and PhD in neurophysiology. His research thesis dealt with excessive methylation in Parkinsonism. At Meharry, he received numerous research honors and was inducted in the Alpha Omega Alpha National Medical Honor Society. Subsequently, he completed a neurology residency at Harvard after he completed a 2-year stroke fellowship at Columbia Presbyterian Medical Center in New York, while completing a master's degree in epidemiology. Dr. Benson has worked in academia, the public, and the private sector. His area of interest and expertise includes health disparity, stroke, minority, community, and global health. Today, he's going to talk about NINDS global health portfolio. With that, I ask that you give full attention to Dr. Benson, and Dr. Benson, stage is yours.
Thank you, Dr. Adil. It's truly a pleasure to present to you today. I'm going to share my slides. Please let me know if you can see my slides.
Yes, I can see.
Okay, very good. So as Dr. Adil mentioned, I'm currently the director of the Office of Global Health and Health Disparities at the National Institute of Neurological Disorders and Stroke. I hope that you all are enjoying the first virtual American Academy of Neurology annual conference. It's been I've been enjoying it so far this year. Today, I'm going to talk about the NINDS mission. I'm going to talk about my office, the Office of Global Health and Health Disparities, some of the NINDS training programs, the NINDS global programs, and then I'm going to talk about the Fogerty International Center, and then I'll end with some questions. I don't have a lot of slides today, and so hopefully we have a discussion and sort of answer questions that you may have And I tried to tailor this talk to things that may be important to your group. So the NINDS mission is to seek fundamental knowledge about the brain and nervous system and to use that knowledge to reduce the burden of neurological disease. The NINDS supports and performs basic, translational, and clinical neuroscience research through grants, contracts, cooperative agreements, scientific meetings, and research in its own laboratories and clinics. The NINDS also funds and conducts research training and career development programs to increase basic translational and clinical neuroscience expertise and to ensure a vibrant, talented, and diverse workforce. And additionally, the NINDS promotes the timely dissemination of scientific discoveries and their implications for neurologic health to the public, health professionals, researchers, and policymakers. Relative to health disparities, this is a topic that I talked about a lot this week. The NINDS is committed to reducing the disproportionate burden of neurological disease borne by underserved groups of society, including racial and ethnic minority, rural, and socioeconomically disadvantaged populations by funding a spectrum of research from basic science through clinical studies and training the next generation of health disparities investigators. What I've learned in doing this work that's puts together health disparities in global health is that some of the same determinants that lead to the disparities here in the US, they're at play globally as well. Some of the social determinants and some of the other factors that we see that lead to disparities, they're the same factors that we see when we look at the global health as well. And so my office in particular was created in August of 2019. And my office, the Office of Global Health and Health Disparities, we lead the coordination and development of programs and initiatives that foster national and international research on disparities and inequities in neurological disease. Some of our objectives include building sustainable capacity in low and middle income countries, LMICs, to conduct and apply research to address public health challenges associated with neurological disorders. So far, a lot of our programs have focused on LMICs. We support bilateral partnerships between the US and middle and high income countries as well. We have a program with countries such as China, some European countries as well, if we see that there's a need and a benefit to us collaborating to address certain problems as well as advancing research on tailored prevention and treatment strategies aimed at improving health outcomes in underserved and understudied populations in the US. And we look at racial and ethnic disparities. We look at rural versus urban disparities. We know here in the US that people who live in rural areas don't have the same access to care as other more urban areas. We look at socio and economically disadvantaged populations, as well as sexual and gender minority populations as well. And we're currently going through a strategic planning process for health disparities at the NINDS for the next 5 to 10 years. I have a lot of slides on that, but I'm not going to talk about that today. So that's not the focus of my research. I'm going to talk a little bit about diversity and why diversity matters to the NINDS. The NINDS is dedicated to a biomedical research environment that reflects the nation's diversity. And that includes recruiting the most talented researchers from all groups of our society and improvement in the quality and educational training environment. And we think that this is improved by having diversity as well. And also leading a balanced perspective and setting research priorities. And so it's important to get diverse opinions in order to have a balanced perspective in terms of our research priorities and improve the capacity to recruit subjects from diverse backgrounds into clinical research protocols. This is very important as well. We like to make sure that whatever research conclusions that we find that those studies have included people from all race, ethnic, and other groups in the society. This leads to more accurate data as opposed to biased data to one group, and improve the capacity to address health disparities as well. So how does the NIH define diversity? So the NIH diversity definition includes individuals from underrepresented racial and ethnic groups or individuals with disabilities who are defined as those with as those with physical or mental disabilities, individuals from disadvantaged backgrounds, socially, culturally, economically, or educationally. And the disadvantaged category applies to mainly high school and undergraduate candidates. The NIH funds training programs from high school to early career, academic career stage. And so this disadvantaged category goes primarily to high school and undergraduate candidates. I show here just some of the various mechanisms that the NIH uses to fund its research. We have some individual awards. These are awards where an individual applies to receive a particular research award. And then we have institutional awards. As you can see across the top of the slide, that we have awards that go across the spectrum from high school to an early career faculty as well. Most of the training awards, the typical training awards, and I say that the typical training awards, because we do have some others as well that I think will be important for me to highlight. But most of the training awards at the NIH, they do have, we have the K, and these are mentored awards, the K01 and the K22. And some of these are for people that are either in their postdoctoral stage or a fellow, and others are for early career stage individuals. But these two mechanisms have the requirement of some type of a US citizen or permanent resident. These are sort of the typical funding announcements, but I'll talk about some others through the Fogerty International Center as well that don't have that same requirement. I mentioned here that in order to promote diversity, that any researcher in the United States that has a grant, it could be an R, a P, or a U, that researcher is eligible to apply for a diversity supplement in order to fund a diverse individual to work in his or her lab. And these diversity supplements usually last 2 years, and it's sort of bridging funding to start early projects for early stage investigators. And it's enough funding usually to get a project started for that diverse individual to apply for more independent funding, either through a K mechanism or some other early career stage training mechanism. It's important, I mentioned early stage investigators. The NIH realized that it's important to foster early stage investigators. We don't want all of our funding to go to senior investigators, and we had to actively do things in order to fund early stage investigators. And we consider early stage individuals who are within 10 years of completing his or her terminal degree. And so if you're within the 10-year period, that's considered an early stage investigator. And early stage investigators actually receive extra special attention in review. If someone is reviewed in a particular study section and is an early stage investigator, we actually can go and look at a different pay line that allows for us to fund applications, more applications from early stage investigators. So this early stage investigator piece is very important. And so if someone here is interested in applying for one of the NIH funding mechanisms that I talked about and falls into this early stage category, it's important to think and remember that benefit. I list here, we have an office at the, we have a training office at the NINDS, but we also have an office that deals specifically with diversity training as well. And that's led by one of my colleagues, Dr. Michelle Jones-London. And I have her email address listed here on this slide. And I here highlight some people that have gone through some of these programs, and they're now investigators throughout the country at various academic institutions. And so these programs are successful. If anyone is interested in learning more about the NIH training mechanisms or how to apply for them, or any of the other NIH programs, I list here some webinars, and I sent the slides to Dr. Adil, so feel free to send to your group if they'd like to look at the links. We have links here to that explains information about some of the K01 and K22. These are the mentor awards, and then some of the early career stage awards as well. And we also have some other social media outlets where people can go and get more information about the NINDS programs. The last one here I'd like to highlight is the Building Up the Nerve podcast. This is a podcast that had in its first iteration approximately 8 episodes, and it actually has a season 2. Each episode actually deals with actually, this is 6 episodes I have listed here. Each of the various episodes deal with various aspects of the NIH process. It's called Building Up the Nerve, and you can get this wherever you get your podcast. And it's very accurate information. It's very fun information. There are two people from our training office who actually interview various people at the NIH and ask questions about the NIH process from submitting an application, going through review, and the funding process. So please take a look and listen to these podcasts. And as I mentioned, there's a season 1 and there's also a season 2 for this particular podcast as well. So now I'm going to pivot to some of the global programs that we have. So my office, as I mentioned, we deal with global health as well. And when we think in terms of neurological diseases, stroke is a major leading cause of death worldwide. Traumatic brain injury, epilepsy, these are also areas that impact people globally as well. And we know that there's a rising prevalence of non-communicable diseases as well. And so these are why we support these types of programs as well. And we support these programs currently in low and middle income countries through some of the mechanisms through the Fogerty International Center. I have here a slide, and some of these slides I received from Dr. Peter Kilmax, who is the Deputy Director of the Fogerty International Center. And I would suggest to your group that you consider inviting him at some point to speak to your group as well, and he can talk more directly to some of the programs that are offered by the Fogerty International Center. They actually have an informational listserv, and they send out information periodically. So if you don't have access to that, I would suggest that you go on that website and sign up for it. They have great information. I received that, and it's a lot of great information. My office also has a listserv as well, and we send information about global as well as national related funding announcement and other things. But you can see here from this particular slide that Dr. Collins is interested in global health. It's considered a top priority, and actually it's one of the top 4 priorities in terms of expanding research into diseases affecting the developing world. And so this is very important to all of us. And so in this slide, I highlight the fact from 2011 to 2015, the number of global awards have increased. And we like to see this continue to increase as well. Some of this we can say is due to the capacity building efforts. A lot of the mechanisms that we have, in addition to funding research, they also fund capacity building in some of the low and middle income countries. And they foster collaborations with institutions in the low and middle income countries with high performing academic institutions in the United States as well. And so the Fogerty mission is to address global health challenges through innovative and collaborative programs for research and training. I highlight both. The research is very important. The NIH funds research, but we also fund training, as I mentioned at the beginning. And so it's important to train investigators who can do research in country related to diseases based upon unique populations that are in certain countries, as well as to advance the NIH mission through global partnerships as well. We have the Fogerty International Center has a strategic plan, and I mentioned some of these things already in terms of building research capacity at institutions in various countries, stimulating innovative research, implementing science, and advancing prevention and control of non-communicable diseases. This is important because there are a lot of, when we look globally, there are a lot of unique populations where we can do certain, study certain research, certain neurological diseases. Also, there are unique presentations of disease, and we can find this by looking at global populations. There are certain diets that are different that we can learn from, as well as unique environments. And so all of these things are very important to us at the NIH in order to address the burden of neurological disease worldwide. And so I mentioned that a lot of these deal with low and middle income countries. I'm going to highlight some of the programs and some of the some people that have benefited from these programs. And I mentioned some of our global programs as well. These go from pre-baccalaureate through early career. The NINDS, now, so these are Fogerty's programs. Fogerty is a small institute, whereas the NINDS, we're a fairly large, medium to large size institute. We receive funding and we fund programs. So the Fogerty has the individual program, and if anything is neuroscience related, we can take those particular applications, particular grants, and we can fund them. And so we actually fund programs through the D43 program, which is a training program. It's in low and middle income countries that have a history and a good solid core of researchers in those countries that have partnered with institutions in the United States. So we fund D43s, we fund Global Health Fellow Scholars. I'm going to talk about this in a minute, as well as we also fund some emerging global leaders. And this is a K43, and any K mechanism is a mentor training mechanism. And you probably have garnered that from my previous slides as well. And we also fund R01s, R21s. Now these particular mechanisms do not have the U.S. citizenship requirement. And of course, anyone can apply for an R01. You don't have to be a U.S. citizen to apply for an R01 or R21 as well. And so the Global Health Fellows and Scholars Program, this is a program it's made up of 5 consortia. Each consortia has multiple institutions in the United States as well, and they're partnered with low and middle income countries. And we have 5 different consortia that we fund. We recently, this particular funding announcement was reissued, and we are participating in this again. Approximately 80% of the participants are either U.S. Postdocs or graduate students or doctoral students, or from low and middle income countries. About 80% are either graduate students or postdocs, and 20% are in doctoral training programs. It's a 1-year fellowship scholarship program where a person from a low or middle income country can actually come to the United States and train either at the NIH campus or train at one of the academic institutions in the consortia. We also will send students or trainees in the United States to the low and middle income country to do research there too. But it's a program where U.S. and students in low and middle income countries can do training. We have a wide range of disciplines as well, and multiple institutes participate in this. The various NIH institutes focus on certain disease areas. I've highlighted here the NINDS, and of course we deal with neurological disorders and stroke. And so we have funded multiple people. I highlight here just one individual that was funded by the NINDS, and this individual is an MD from Peru, and he was looking at environmental and genetic factors of Parkinson's disease in a rural village in Peru. And so this was one of our fellows and scholars awardees here. We also have a K program, the NINDS. There's a K01 and the K43. We participate in the K43 program, and these are mentored programs. Individuals have to have a mentor at a institution in a low and middle income country. And again, these institutions are those where we've provided some investment to build capacity to do research in those countries. and they partner with an institution in the US. And so these individuals will have a mentor in his or her own country as well as a mentor in the US, and they'll work collaboratively to develop the programs. The goals of this program is to develop strong investigators in the low and middle income countries who are competitive for independent funding. As I mentioned, anyone can apply to R01 funding. So after having these types of awards, excuse me, we expect these individuals to be able to apply and to compete to get R01 awards as well. And it provides 3 to 5 years of support, mentored support and career development for early stage career investigators in low and middle income countries. And it provides salary and research support. And the salary support is based upon the local salary in that particular country. The program requirements, again, it's a low LMIC investigator with a junior faculty position at a LIMC institution. Only one LMIC institution is eligible to apply, so you can't have multiple people at the same institution supporting individuals. The applicant can't have funding, other NIH funding as well. It has to be an early stage investigator. And as I mentioned, the person has to have a mentor in the US and from his or her own institution. And the research activities are to take place in country at the low and middle income country. This is one of the investigators I worked directly with him as well, Dr. Mark Kadamukasa, and he's at the Makerere University in Uganda. He was one of the previous fellows through the Fogerty program, and he actually received the K43 grant from 2017 to 20, and it goes until 2022. But also at this particular university in Uganda, they have multiple investigators that are trained in the neurosciences and other research fields. And so they actually applied for one of the other mechanisms I'm going to talk about in D43, and that's a training program so that Dr. Kadamukasa received this grant. He'll apply for his own awards, but also they were able to apply for an award where they could train other students in their own country. So again, I mentioned it's to build capacity. So with the D43, they can develop a training program in their own country to train students there. And his topic deals with seizures and quality of life and stigma. I have here a slide from Dr. Roger Glass. Dr. Roger Glass is actually the director of the Fogerty International Center. If you have not met him or talked to him, it's very important. He's a very nice gentleman, and he's definitely dedicated to this topic of global health, particularly when it relates to the nervous system. We actually have a funding mechanism called the Global Brain. We have, in addition to the NINDS, other NIH institutes that also have neuroscience as part of their focus that participate in this. And it has been very successful, a lot of the programs that deal with neuroscience, and they've done pretty well. So I can't stress enough that you should go to the Fogerty website. You should sign up for their listserv. Also sign up for the listserv in my office. And I suggest as well speaking with either Dr. Glass or Dr. Kilmarks, who I mentioned earlier. And again, a lot of these slides were provided by Dr. Kilmarks, the ones in the green. And so now I highlight here, again, these are some of I mentioned some of the programs that we fund at NINDS. We fund specifically a R01 program. It's the Global Brain Program. And so this is, again, a program where we're looking to build capacity. Oops, let me go back. We're looking to build capacity in low and middle income countries. And these R21s are short, early developmental projects that we fund. Also, sorry, my slides are moving on their own. Also, we have the R01 program, which is the Global Brain Program. So we fund R01 programs as well, and these are global. We fund the K43 program, I mentioned that before, and also the D43. I mentioned the difference between those two. And so any low and middle income country can apply for this. And so I have the program and announcements listed here, and so you can look these up and look at the information related to that. We also have some new funding announcements that are looking at mobile health technology and outcomes in low and middle income countries, as well as there's something called the DSI Africa program, and we're trying to look at science and discovery as well and innovation in Africa. And so these are just a few of the programs that we have. We tend to focus more on low and middle income countries because we like to build capacity in those countries. As I mentioned, we do in some instances partner with high income countries as well. China is one that we've worked with in the past. I mentioned some countries in Europe as well. But when we start to look at the high income countries, there are other regulations that tend to come into play that makes it more difficult for us to fund projects with certain countries. And so these are the people in my office who help me to do the work. I work very closely with others. Stacy Chambers has worked for a long time dealing with a lot of the global programs that we have in my office. And I think that's, I list here the website to my office. And so if you go to my website, we constantly update funding announcements related to health disparities in the US, as well as funding announcements related to global programs as well. And also we have a listserv where we'll send out information periodically. And then I have the link here to the Fogerty International Center. Again, I think you should go to their website as well and sign up for their newsletter and their listserv as well. And I think that that's very helpful. That was my last slide. I'm going to stop sharing and then I can open up the floor to any questions that you may have.
Thank you, Dr. Benson. This was great. Thank you so much. I think there are a couple of questions in the chat box. I'm gonna read to you. So first question is, you elaborate some on the collaborative projects such as with China. What are topics that might be useful for collaborative internationally?
Well, so that's a great question. So when we collaborate with a high income country, we tend to look at those things, those partnerships that are unique that we can use that can benefit both countries. For instance, in some of our collaborative programs with China, some of the projects that I can think of off the top of my head deal with pain and pain control. As you know, that there's an opioid epidemic in the United States. A lot of the medications that we use to control pain have the addictive properties to it. China is a very old country and they have a lot of other non-pharmacologic addictive methods for treating pain. And so that's something that's unique where we can sort of learn from how a high income country is addressing a particular medical problem. So that's one in particular. So when we think about another is, well, we know that some of the embolectomy trials that were global, in order to get the numbers of people participating in the studies that we needed, we've had to partner with other countries. And obviously, when you're looking at embolectomies, you have to have a country that's developed and able to do those really highly specialized procedures. And so we partnered in a lot of stroke studies as well that required those unique interventions. So usually when we're partnering with high income countries, there's a benefit to both countries where we can do something unique that either country can't do on its own. But that's a great question.
Thank you, Dr. Benson. The second question is, can a mentee on a visa apply for the diversity supplement if the mentor has an independent research award?
A lot of just the visa, I think a lot of the mechanisms that I talked about initially, I think they require the diversity supplement. I have to look particularly at that one. I know that the K awards have the citizenship requirement. It may not be true for the diversity supplement. Let me check into that and I'll let you know. It may be slightly different for the diversity supplements. But those are sort of 2-year individual grants, but you have to be in the lab. Now there's the diversity supplements that I talked about. You have to be from and your institution has to show that you're from one of the underserved groups or disadvantaged group or something. So that's a requirement for the diversity supplement. I think that the citizenship requirement is different, but then you have to, if it's a diversity supplement, you have to fall into one of those diversity categories. Now we do supplement other applications, but I think those are more difficult to get as well.
Thank you. Thank you. So the other next question is, what are the high priority areas of research at Fogerty?
The high priority
The
research.
high priority or focus areas.
Neuroscience is definitely one. Neuroscience is one of the most cross-cutting areas, medical areas. The NIH has 27 various institutes, and 16 of those 27 institutes have neuroscience focus at some point. And so I mentioned in my presentation the global brain initiatives, and those we have the R01 and the R21. And so all of those are not the NINDS. We have mental health, we have aging, we have National Institute of Allergy and Infectious Disease, we have mental health, National Institute of Mental Health. All of those deal with neuro or brain-related disorders as well. So neuroscience is definitely a big focus at the Fogerty. And I highlighted some of the individuals. And so when we look at a lot of the people that have been successful in some of the programs, they were in the neuro realm. In actuality, if you sign up for our listserv, we actually, the Fogerty hosted a global brain workshop where we had people from around the world actually, and there were people from Pakistan, India, and other places that participated in this as well. It took place in March, it was February or March. And so if you sign up for our listserv, you can get information for next year for this particular workshop, but it was a virtual workshop, and it was about 4 days actually, and it was some excellent research that was presented. And so we had multiple NIH program directors, including myself, representatives from Fogerty, and people internationally that highlighted the work that they're doing. So neuroscience is really a big area from Fogerty.
Great, thank you. Next question is, can we have a list of successful Fogerty grants in Pakistan? I know University was awarded one more than 10 years ago to Aisha Kamal. I think in the chat book, somebody's shared the list of awards also.
Yeah, I think that's something that you could probably get from actually some information you can get from the NIH reporter. Some of it is public, and so most of the information is public, or you can go directly to the Fogerty International Center, and they should be able to let you know that. Actually, it's called the NIH Reporter. If you go to that actually, I think, lists that information. It actually, on that particular website, you can see where the NIH funds various projects globally in the whole world. And actually, you can move the cursor around and sort of look and see what's funded where.
I see. Good.
I see someone just put that in the chat.
In the chat, yeah. The next question is there a way to go and look up successful awards and collaborators, mentors for K43 award?
That's a great question. Again, I think there's multiple ways to do this. As you know, in academia, you can develop partnerships through word of mouth, but the other way is just sort of look and see who's been successful and see what they're doing. And so I think, again, if you go to the NIH Reporter and you see who's been funded, and then just call that person up and just say, hey, I see that you have this Fogerty grant that you're working with internationally, and just say, I'd like to learn more about that. I can tell you there's a large center at Mass General in Boston. There's a global program at, there's quite a few. I don't want to throw out institutions, but there are a lot of them throughout the country. And so I'd say to start by going to the institution, looking at see if they have a global program, and then you can look and see who's actually working in a particular area. And so I mentioned that there are consortia. So there's 5 different consortia, and each consortia has multiple institutions in it. And so these are some of the major academic institutions in the US that you could, I'm sure all of you could just name off the top of your head. But I think, what you want to do is to go and talk particularly to those investigators and just ask them, about their program and see what they're doing. The other piece that I want to mention is that if you have a particular research idea, let's see that if you go to the Fogerty site or you go to our site and you see a funding mechanism that you think is interesting that you'd like to apply for, then look down through that funding announcement and there should be a program director listed. If you see my name or if you see someone else's name, I'm happy if you have a research idea or you're interested in applying to a particular mechanism, then call up that person who's listed as the program director on that initiative. We're federal employees and we're here to help people. A lot of people think that they're bothering the person. I mean, we are very busy, but this is part of our job. And so we'll schedule a meeting to meet with you. We may not be able to meet like today or tomorrow, but we will set up a meeting in a timely fashion where we can discuss with you your research topics. People send us specific aims. They'll send us ideas that they have and we'll read through them. We can offer comments and then we can say, maybe you can consider this. And in some instances, we may be able to say, well, this particular investigator received this award, maybe you should. Now we can't force someone else to talk to you. And so that's why I'm telling you, you should go to the investigators, and we can't tell you about someone else's research project unless it's published. And so we may say, maybe you should go and speak with Dr. So-and-so. They've applied for this award in the past. And some of that you can see from the NIH Reporter. But after you've spoken with the person and you developed your team and you have a particular project, then please call your NIH program director and ask them, say, I have this idea, what are your thoughts? Do you think this is appropriate for this particular funding mechanism? And what are your thoughts? We oftentimes have these meetings and we've met with people globally I have meetings all across the world. We set them up at different times of the day so that it's convenient. I had a meeting in China where we met at 8 o'clock at night and another we met at 7 in the morning. With 12, 13-hour time differences. And so, we'll meet with you, people from your team, and I'll pull in people from Fogerty as well to optimize the time. And so the Fogerty people can speak specifically to their mechanism, and then we can talk about the priorities to the NINDS.
Great. Thank you, Dr. Benson. I think this is the last question, but this is regarding healthcare disparity. So I would like to know what would be the next step if I would like to do a study of the current status of stroke healthcare disparity in the county of Frederick, Maryland, and or adjoining Washington County.
That's a great question. Now, I talk about that all the time, but I purposefully did not talk about that today because I tried to focus on global health. But whoever asked that question, please ask me or email me directly. But what I would say to you is that we actually are planning a workshop, and I didn't talk about this as well. We currently are going through a strategic planning process to address health disparities. We have experts from across the country, from various academic institutions and various disciplines that we're working with. We're going to have the workshop September the 22nd, 23rd, and 24th, where we're going to discuss the best way of addressing health disparities in neurological disorders. And these are all, not just stroke, but these are all neurological disorders. Services and care, we know that as well that rural versus urban issues are also problems. So if you're in a rural area and that's an issue and you have an idea of how we can better provide care in a particular area or a higher treatment or better treatment for people in a particular area, then let us know your idea. But please go to email me or either go to my website and sign up for our listserv. And we have on our webpage, there's a link to the, it's called the Headway Workshop. The page registration page should be active by the end of this month. You can register to be a virtual conference. It's a free conference. It's going to be that Wednesday, Thursday, and Friday in the afternoon. The first 2 days we have lectures. The last day we're going to have breakout sessions where we're going to talk about things and sort of address these issues. But I could talk all day about the disparities piece, but I'd say please either email me or go to the website. Yes, thank you. Someone is very fast in terms of pulling up information. So yeah, they just put it in the chat as well. Right now, the link is not live. It'll be live by the end of the month, but the listserv is live and our webpage is there. So you'll have to come back and check to register for the workshop. And we're finalizing the speakers. It's going to be a great conference, a lot of great speakers we have set up. And I think Dr. Dill, did someone else in the chat?
Somebody, Dr. Tipu Siddiq wanted to ask a question, but I don't see if he has typed it yet. So
Okay.
I think he's probably typing.
I'm
Thank you, Junaid, for your prompt responses. That's why we put you in the executive committee. So
no, that's good. Yeah, I see. Yeah, they're working very hard. So he wants to ask the question live. Is that what that?
Live question. Okay. Dr. Danish, can you unmute Dr. Tipu? He wanted to ask a live question. I think he's
unmuted.
He's unmuted. Go ahead, sir.
Hi, Dr. Benson.
Hi, Dr.
Wanted to introduce myself. I was a Fogerty fellow a long time ago, many years ago. But my question today is that how does one connect with people? And I've trained people from North Africa, East Africa, other places. But now we have a very specific project in the laboratory that pertains to very specific disorders in Africa, like sleeping sickness. And so I've been looking and I've been talking to people. I haven't found anybody how we could train people from either the West African area or East African area with the two different variants that infect, the trypanosome. So we have developed the only viable genetic model that is transmitted from generation to generation for testing drugs. But obviously, for me, it is more of an interest if somebody younger person who is willing to be trained and can be funded to come and learn those things in the lab and test those drugs and so forth to see. Right now, the issue is that you go from tissue culture to humans, and that's it. There isn't a model. So how does one connect with people who one thinks have passion about science and disease? That's from those regions of the world. I know people, for example, in Pakistan or other places, but I don't know anybody directly in Africa. The previous generation is gone that I knew from North and East Africa. So
I think that's a great question, Dr. Siddiq. And it sounds like very interesting topics, and your work sounds very interesting. And obviously, you must have been successful being one of the previous Fogerty Fellows. I would say through going to these global conferences, that's the way you go and you go and sort of meet with people there that are doing this type of work. If you're looking with a lot of work now is looking at non-communicable diseases, more chronic non-communicable diseases, or NCDs, we call them. However, obviously, there's a lot of work that's been done in the communicable infectious disease space as well. There is some infectious disease work that the NINDS does, but a lot of that is done through the NIAID, and they have done a lot of global work as well. But I would say going to the global programs, global meetings and conferences, and talking to people as well, and then going to some of the academic institutions that have global programs or training programs, and invite yourself as a, you look like a very distinguished, seasoned investigator, invite yourself to speak at some of these academic institutions that have global training programs, and talk about the research and work you've done over the years. And just, ask if anyone is interested in that. And then you can get to know people that way as well. But I think that it's important to share information, to meet with people, and to go to these conferences. I think that that's a really big way of sort of developing those connections. But that's key. Unfortunately, people sometimes, there are a lot of silos and it's difficult for people to get outside of those silos. But I mean, you sounds like you have a very interesting project, and you just have to, you know, market yourself, get yourself a good person to help with social media as well, to put yourself out there with the work. I think that would be good as well.
Great. I don't think there are any questions. Dr. Benson, thank you so much. This was very informative. If nobody has any questions, then we can move towards the next session.